Welcome to the Consult Before the Cut, your go-to podcast for all things anti-aging, aesthetics, and plastic surgery. I'm Dr. Jonathan Weiler, a board-certified plastic surgeon with over 15 years of experience.
I am Taylor Besh, physician's assistant and expert injector at Weiler Plastic Surgery.
And I'm Brittany DeSherry, nurse and COO over at Rejuvime Medical. Each week, we'll dive deep into the latest trends, expert insights, and real stories from the world of beauty and wellness. So grab a seat at the consult room and let's discover the secrets of timeless beauty together. Hey everyone, welcome to the Consult Before the Cut. I'm Brittany DeSherry, COO over at Rejuvime Medical. Of course, I've got with me our sidekick today, Dr. Jonathan Weiler.
Yes.
And next to Dr. Weiler, we've got Taylor Besh, our expert injector. And today we've got Bree Berard, who nurse practitioner over at Rejuvime Medical.
Yes.
Hello.
She is going to be our expert today because we are going to dive into a very hot topic, like you said. Literally and figuratively. We're going to talk about menopause today.
Right.
And Bree, just before we get started, tell us a little bit about, you've been at Rejuvime for how long now?
Ooh, 3 years?
3
More
years?
than 3?
3 years?
3 years?
Has it been more?
I think you've been there longer.
I think it's been a little longer.
I think you're hitting on
Probably
4.
closer to 4.
Yeah.
But,
I don't know. How old's your daughter?
We don't want to talk about ages, okay?
No.
Young
Hitting on
forever.
4 years there,
Young
Bree.
forever. I think
Yep.
4 years, though, actually.
All right. So menopause. Okay.
What a topic.
This is,
The
I mean,
topic.
it is
The
out
topic.
there. This is something I feel like that was never, it was just,
This was
it is what
not
it is.
talked about.
You're a woman. I'm sorry. Like, it's menopause. It is what it is.
Your life is over.
That's it. That's all it was. And
Yeah.
then all of a sudden, I blame Halle Berry, or I
Give all the credit
give
to
all
her.
the credit
Yeah.
to Halle Berry, because Halle Berry came out and was like, absolutely not. And then all of a sudden, everyone started talking about menopause.
Right.
Right. Everywhere you look, they're talking about it.
They're
And
menopause. It's menopause. But,
yes.
You know.
And what's interesting, to give a little, so Rejuvime was started many years ago and was primarily started as a male sort of testosterone
Right.
clinic. But because of our amazing practitioners, such as Bree, it evolved into a very prominent female menopausal sort of
Absolutely.
clinic, right? And
We
it's,
see-
guys do an amazing job.
I would say close to half and
Yeah,
half.
it's 50-50
men
now.
and, men and
Right.
women.
It
and
reflects the population, so which is
Absolutely.
50-50.
Which is amazing.
Yeah, and women flock to Bree and the ladies over there.
It's because it's so life changing, y'all. It truly does change the way that you navigate through these years and the way that you experience perimenopause, menopause, postmenopause, and so it really can help give you your life back.
But I feel like it was hush
Oh,
back
yes.
in
Oh,
there.
absolutely.
and I still feel like it's a little bit controversial.
It is. I was about to say, it's just
it's the
starting
Botox,
to
the
evolve.
hormones are the Botox
Yeah.
of 10 years ago.
Yes.
Yeah.
It's, people want to do it. They are talking to their friends quietly about it.
Mm-hmm.
Right.
They're looking online, but they're not actively really speaking. Halle Berry, obviously, but
That's it, yeah.
and our lovely guest we're going to have later on in the episode.
Well,
but
this is, I know.
it's still
we-
controversial. And it's
It
still a
is.
little
Yeah.
bit taboo.
Well, I know this is what we talked about. It's the group text. It's
the group text,
It's the
and-
group
The group
text
text.
of all the girls. That's like,
Yes.
okay, this is what's
What
happening.
is happening?
It is.
Right.
Somebody help me, But can you go back? Tell
Define.
me, what is
You
said
menopause?
perimenopause, menopause.
Okay,
You said
so
many
Walk us
words.
through life.
Menopause, of course, is going to be a whole year without having a menstrual cycle. So it really is, this whole changing effect of when you quit ovulating, you quit having these periods. It can last anywhere from 5 years to 15 years in those pre-years or peri years during that, where
peri,
you're
which is
having.
Is that
right?
pre?
Yes.
So before.
And that's when you start having, oh, my cycle's changing a little bit. Oh, this is different. I'm starting to have a little bit of symptoms. Maybe you're not, but it's when all of that starts to change. So you could experience severe, it could be very light symptoms. Really is different for everybody. And then those postmenopausal years is, of course, after you've quit having that cycle. You've quit ovulating, and that is the end of an era. Or the
It is the
beginning of a
end
new
of an
one.
era.
Right.
It really just
But it
depends
can
on
be
how
the
you look
beginning
at
of a
it.
new
Yeah,
one. Absolutely.
Give us the biological, medical reason
Yeah.
why women sort of go through the hormonal stuff. Does
The
that make sense?
hormonal stuff,
Yeah.
yes. So your follicle stimulating hormones, right? So that is your brain telling your ovaries, hey, we need to ovulate. We need to kick this egg out. We need to have a baby, right? And that's its main job. And it does that, and it'll kick back and it'll say, hey, why aren't we ovulating? It's because you're losing eggs. You only have a certain amount, and those are the amount that you're given. And once you've depleted all of that, that's it.
That's it.
It's gone.
It's
You're
gone.
done. And then your
Goodbye.
brain tells
It's
your
gone.
body to
continue to produce more estrogen, and your follicle stimulating hormone, it fires and fires and fires and fires, and that's when it rises. And so you'll get these high numbers, like 150.
This is
And
this
then-
estrogen
and
dominance, right?
that is your follicle stimulating hormone still. And then
Okay.
it's asking for more estrogen and progesterone, and then you get these very bizarre numbers. It can be really high and then really low, and it depends on the day that you check your hormones. So sometimes it's hard to just look at the labs and say, oh, you are or are not in this stage. You really have to listen to that patient too.
So, Bree, you're getting real technical there, which is
Yeah.
great, right? For our
I know. Take it down a notch.
Okay.
With
right.
I am probably pre-menopausal, so perimenopausal. So
Yeah,
tell
yeah,
me what I will be experiencing, and I know every
You're
single
still
patient
pretty
is
young,
different.
Taylor,
You
but-
are
But like,
young.
say in the next
Calm
5 or
down.
10 years, what to expect
Right.
when I am
And what is
true.
so let's okay, so what drives the female hormones are what? What are the primary female
So your
hormones?
estrogen, your progesterone, and surprise, your testosterone.
Testosterone.
Ah,
right.
there she is.
And
Yep.
so what
She's
happens?
here.
So Taylor has a birthday or
I'm 40.
40. Okay.
Yeah.
Birthday.
So from
Happy birthday.
From 35 or
Yes.
40 to 50, what's going on there?
Absolutely.
What's happening?
So
And
your
that's
ho-
perimenopausal,
That's
which is the
perimenopausal.
medical for
That's
premenopausal.
the
Right.
pre. That's
Right.
the
Okay.
before we go into full blown menopause.
that is the start of the change, right? And so you can experience a change in your cycle. Some women do, some women don't. And so it can be a longer or shorter cycle, meaning more frequent, less frequent, either one. It's crazy because it can differ from woman to woman.
Yeah.
And then you may start experiencing some side effects. Holding on to extra weight in the abdomen is one of the biggest ones that women come in for. They're like, I used to be able to do X, Y, and Z and drop 10 pounds before summer. And this year it has not happened. So that's a
Mood.
big one. Mood changes, libido changes,
Yeah. Spike or go down.
spike or go down, hot flashes, night sweats, frozen shoulder, joint pains.
What is frozen shoulder? Do I have?
It's exactly what it is. It's like
It's
the
just
joint
like-
So we
pain
get
in your
stuck. It can
shoulder. It
happen.
feels
I'm like-
stuck.
It can happen.
That's what I'm like. I'm sorry.
Yeah.
I'm just going back to that real
Lots
quick.
of things.
But
Yeah.
and these are sort of irregular come and go, right?
Come and go.
Issues,
So you're
problems.
like, oh, it was
not
just the week.
right. Not every single
okay.
day.
Not
Yeah.
every single day.
Those problems start when you hit the big menopause.
The big menopause.
And so, just very basically, what happens with menopause with the hormones?
they're gone.
They're gone.
And
They're
once
gone.
they're gone,
They're
they're
gone.
gone. And
They're not coming
so
back.
adding additional hormones can be game changer to supplement and suppress some of these symptoms. You're
Mm-hmm.
treating the symptoms. You're treating the patient.
Because what happens is, remember, so with perimenopausal or pre, you're having these little bursts,
Little
right? Like, oh, I'm
spurts.
gaining a little
Yes,
weight,
yes.
or hey, but maybe I'm not, or maybe
They're like,
I'm
ooh, I had hot flashes 3 nights this week.
Correct.
That was weird. And then
Correct.
you never have them again for a month.
right,
You're
right,
like, was that?
right. And then when
Was it just
menopause
hot?
happens,
Was that just hot? Yes.
every symptom comes on every day
with a vengeance.
with a vengeance,
Yeah, that's
Yes.
right?
Not letting go.
Not
not letting
Just
go.
letting
like,
go.
I'm here now.
And
Hi.
you're like, hi, please help me.
Please help me, because you have to
Yes.
work through because they do go away eventually, right? But
In
you
most
have
people,
in most
yes.
people, but you have to choose: are you just going to fight through it and then go into menopause, right? Or are
Mm-hmm.
you going to have all those symptoms and say, "I'm not going into that dark, deep tunnel.
Yes.
I'm going to fight for my life and
Right.
restore my hormones," right?
I guess I
Absolutely.
get confused because some people are like, I'm going to fight through it because when I get postmenopausal, it'll be fine. So is it like a intense time during that perimenopausal, and then when you
It
get to
really varies so
Yes.
Yeah,
widely,
okay.
Taylor, that for some women, they don't even realize they've gone through it. And then depending on, other things going on with your life, if you're on an SSRI, sometimes that'll mask some symptoms. So it really does vary so greatly.
Well, and I think the thing to differentiate is some of the major issues like the fluctuations, so you can get through those, but then when if you accept menopause and accept the lack of the hormones, you then have to deal with a whole separate set of issues about life without those hormones. So it's two sort of, the menopausal, premenopausal, menopausal issues, and those can last the menopausal issues for 6 months or a few years, or like you said, some people don't experience them. Some people
Right.
have severe as they go through menopause. And then once you get through the window of those hormone fluctuations and all of a sudden the hormones just stop, you then have a separate set of issues with a female body without hormones. Does that sort of make sense? And so there is a separate set of issues at that problem. And they're not wild fluctuations. It's just a host of new problems. I am a postmenopausal woman, which means I'm a female that does not have the hormones that she had for the last 50-something years. Well, not 50, but 40-something years. So it's a hot
Age range.
You know, anywhere
I know,
I see women age 35 all the way to women in their 60s who are like, you know, I never treated anything, but now it's really bothersome. So, you know, huge range there.
huge range.
So, yeah, I'm like,
I saw some doctor in Baton Rouge last week. She's like, I am so tired of seeing all these billboards that say got wood for men. And she's like, it is about darn time that we start saying got hot flashes. And like, hello, it's happening. And we're here for it.
like,
Yes.
First and foremost, hats off to their like advertising team.
Yes.
That's cracking me up. This is a specific.
But the awareness that
company.
we're
It's
bringing
wild.
is
Yes.
truly life-changing for women, you know?
Absolutely.
I just think it's so much more, you know, everybody's the TikTok, social media,
Yes.
Instagram, all this kind of stuff. It's so much more. It's all over my feed about menopause and, you know, fighting it and what you can do for it and everything like that.
So brings us into our next question. What do you do?
What do you do?
Right. What's
So
the
I've come
what's
to
the
you.
process?
The whole process. So, of course, we get labs just to kind of see. And like I said, it's not all based on that. It's based on the person, the symptoms, their history, what their risk factors are for things. But you can add a little estrogen, which is going to help give you a better mood, help with the vasomotor symptoms. So that is going to be your hot flashes, your night sweats, things like that. And then we add in a little progesterone too, to not only protect that uterine lining sometimes if you still have your uterus, but also to help with sleep, help a little bit, just give that balance so you're not on edge. And then we also help supplement with testosterone, which gives you your life back. It brings back that vitality, your libido,
Makes your muscles
Yeah.
stronger.
makes your
again.
muscles stronger, protects your bones.
Protects your bones.
So then,
How do you administer these hormones?
So it really
typically?
depends.
I know there's a bunch of different ways.
There's
Is
a
it-
bunch
yeah.
of different ways.
Right.
You can do some of them orally, which progesterone by far best data on that is orally. So I always recommend that orally at night before bed.
For the
but
good
then
progesterone
for the
sleep.
good
Oh, yeah.
progesterone sleep like a baby, and then
Good song.
the others you can do the estrogen, of course, orally, topically in a little cream. Those are probably my go-to for starting out. That way we can see how well you do on them. You know, make sure they're giving the proper effect before we go and do something like a little pellet.
okay, so that's what I was about to say. Okay, so pellets.
Yeah.
Pellets.
Love a pellet.
I think pellets are amazing. I feel like women are always like, I don't have time. I have so many
I
things
don't
to
have
do.
time.
I have 4,000 things to do today and I don't have time. I've forgotten to take my medicine. I'm doing
Yes.
all these kind of things. And like Bree was saying, if you can go ahead and, you know, get that finesse and get that, you know,
Yes.
patient on that right dose, pellets are such a good option because
Such
they
a good
last
option.
for months. And so
Yeah.
this is like a
Yeah, you don't have to think about it.
You don't
You don't have to
have
think about
You
it.
just kind of get in there. You come see me for a quick little appointment. We
Yes.
talk for a couple of seconds, and then you're done.
I do agree with Bree though. You know, pellets right off the bat. I think that's kind of. I mean, if
you
somebody's
wanna
been
get
on,
your
you
dose
it's like
where you
let's
want
go
it to
ahead
be.
and kind of like find that fine line so we can make those adjustments because that is something.
And make sure you don't have side effects. You
Yeah,
know?
absolutely.
Especially for the testosterone too. Women especially come in very, very nervous about testosterone.
Oh, yeah.
They're
Yeah.
like, that is not for women.
Right.
I don't want to, you know, get these big muscles and have broad shoulders. I'm like, well, that's a stretch here.
That's we're not
They
going
don't
that
want to
far.
grow a beard.
Right,
I'm
wanna grow a
like,
beard like me.
Yeah. And most of the time, you're not going to. I have not seen a woman with a
I
beard
don't have a
yet.
beard.
I don't have a beard
I
yet.
know, I'm like-
So as long as your, you know, side effects are totally manageable,
Yep.
but you do want to make sure it's the right dose for the patient, the right method to fit into their lifestyle. So
Is this you know, hormone replacement we always talk about. Like this is the long haul.
This is the long haul. It's not something you necessarily want to start and stop and start and stop.
Don't cycle.
No.
Ooh, not great.
Because then you're going through menopause every couple
Then you're really, really making some
You're
change.
going through menopause
400 times.
Your medicine's going through menopause. Everybody's going through menopause.
So you really want to be consistent. You want to think the long term. And it is something that can be done safely for the rest of your life.
Okay.
And I will say that here at Rejuvime, we have a lot of, which I find this to be so interesting. We have a lot of OBs and GYNs that will say like, you need to go see Rejuvime because they take the time, they take the minute, because it is such an in-depth thing. So sometimes, I've always, my mom went to her GYN, when this came about, and it was just, it was kind of just like in passing, and it's like, no. Like, this is a thing. Like, you need somebody. This is going to be a journey. Like we said, getting the appropriate doses and having that check-in. It's an up and down. You're going to have it sometimes not. So it's like making sure that you have somebody that can take the time to really investigate, sit down, talk to you about those symptoms.
It's not an easy arm of medicine. I would liken it to my daily routine obviously is aesthetic surgery. And I do so much of it, I don't have the time or expertise to dive into injectables. That's where Taylor comes in. I also had a strong interest in, the anti-aging arm, and it's better to have these practitioners like yourself that come in and every single day, whether it's a male or female, they're dealing with hormonal issues.
Yes, all day, every day.
All day, every day. And they have the time and the expertise to deep dive into it because it's a thorough discussion. It's an evaluation of labs. And there's so many tools to use and everything has to be so personalized and customized. And the GLP-1s have also added that extra sort of step because weight gain is a huge issue with menopause.
Yeah.
And it is, and that's really where we specialize with those GLP-1s is the weight gain with menopause.
Yeah. I'm excited.
Yeah. Let's take a little break.
Yeah.
Okay.
We're going to bring back our little special guest, one of your patients, right?
Yes.
A wonderful lady that I've just met. But we'd like to thank our sponsors, Weiler Plastic Surgery Group, the state's largest aesthetic plastic surgeons group. We have 5 surgeons. We've got over 10 injectors with multiple locations. We'd also like to thank Rejuvime Medical, the anti-aging clinic, right? And so Bree's one of our wonderful providers over there. We specialize in hormone replacement for men and women, GLP-1s, aesthetics, and some peptides. So stay tuned, guys. We'll be right back.
My name is Felicia Ferranti. I'm from Mandeville, Louisiana, and I had a breast augmentation. For me, I knew that I wanted to go natural. I knew what I was looking for. I remember finding Weiler's website, and I was like, this looks really natural. This is exactly what I'm looking for. Having my clothes fit is a life changer. Seriously, just nothing ever fit my shoulders, nothing ever stayed on me properly. That's all I ever wanted to do was just fill out my clothing, and that in itself, literally a dream come true. I know that sounds dramatic sometimes, but seriously, it is a dream come true.
My name is Josh Hughes. I'm 43. I'm currently on the HRT program. I just started feeling the effects of getting older, being tired all the time, not motivated, sore when I would do physical activity, and just needed a change. I've been on the HRT program for around 3 years. Within the first month, I completely noticed a huge difference in my mood and energy. The weight that I had gained started to drop off rapidly. It just gave me a new lease on life. It made me feel like I was in my 20s again.
All right, everyone, welcome back to the Consult Before the Cut. We have a lovely patient here with us today who is going to share her menopause journey with us. Her name is Pam. Welcome, Pam. Thank you so much for joining us today.
Oh, thank you.
I just want to know a little bit about you. Can you tell us a little bit about yourself and
just like I'm Pam.
As much as you want to divulge, where are you from?
I'm 56. I live in Denham Springs. I have 3 children. I have 1 grandbaby and 2 grandbabies on the way.
Congratulations. That's fun and exciting.
How are you so beautiful?
I know.
It's hormone replacement.
So you got kids, grandbabies, more grandbabiys on the way. Things are happening. So
We're empty nesters. I've been married, be 35 years this year.
Wow.
That's amazing.
Yeah.
That is absolutely
I want to know,
amazing.
take it back to the beginning. Take it back to you were my age. You were 40. Were you starting to feel a little different?
Yes. As a matter of fact, whenever you said you were 40,
Okay.
earlier I was thinking, and he said you're too young. I actually started feeling that way about 40. But I had an ablation when I was 40 because of really heavy periods. And so I never had a period after that. So it was kind of hard to tell whenever I was going through menopause because I didn't have a period from having the ablation thing. And I remember at about the age 44 was whenever I finally went to the doctor and I said, something is wrong with me.
Did you, was this your primary care or was this like your GYN that you went to?
It was my GYN.
Okay.
And the hot flashes were out of control for me. I'm not an anxious person, and I was feeling anxiety, depression almost, and I'm not really that type of person. I was working out, and I've always worked out, and I just couldn't put on the muscle, like used to. And so I went to my gynecologist, and she said, okay, I'm going to put you on. I tried to think of what it was back then. I think it was Activella. I don't know if you know what that is. It's a hormone. I don't know. It's a synthetic. I do know that. And it took away the hot flashes. And I was like, okay, I had no libido. And that's one thing it's hard to talk about because I feel like women don't want to talk about that. But I will tell you, at that age, I felt like I could have gone the rest of my life with never having sex, which is not good.
Right.
For your marriage.
Yeah.
Not good for your That's the one man in here.
And thank goodness I have such a wonderful patient husband. So she put me on that, and it took away the hot flashes. And then I go back to her probably 6 months later, and I said, okay, the hot flashes are gone, but I am super anxious. I feel depressed. I have no libido. And she said, okay, I'm going to put you on an antidepressant.
There it is.
And I knew right then when she said that, antidepressant side effect, weight gain, no libido, and I'm like, how is that going to help? And so I just left so frustrated. I never filled that prescription because deep down I knew I did not want to take an antidepressant.
Something else was going on.
And I think back, I do have no idea who told me about Rejuvime, but somebody said you need to go have a full panel of your hormones tested. And they said, go to Rejuvime. I really don't remember who it was. And I was 44 at that time.
Whoever it is. Yes. I love that. Whoever it is, I love them.
I was so thankful because I walked in. I cried at everything. I raged at everything. Like I really thought something was wrong with me. And so they did my labs. A week later, I go back in and they just looked at me and they're like, how are you even functioning? And I was like, oh my gosh, there's something wrong.
I knew there was something.
Like my hormones were so low. My estrogen, testosterone didn't even register.
Wow.
Like,
That's so wild. And it's just, you know, when you go to your doctor and you're like, something's wrong. And they're like, oh, you're fine. Like, it's fine. Don't worry about it. And it's like really, then you feel
So
like you said that discouraged feeling and just being able to find somebody that you can talk to.
So did your OBGYN ever talk about hormones with you?
She did. Well, she did just the Activella that she put me on.
And I think that was just for hot flashes, like for hot flash treatment.
No,
right?
there's a new medication out for that.
Yeah, I was about to say,
It's a synthetic hormone. It's mostly estrogen based.
Okay.
And it does alleviate some of those symptoms, but it's not, and Bree can talk more about this, but it's not really treating all the hormonal deficiencies, correct?
And it's not going to treat like the physical effects that it has on you with like the vaginal dryness and things like that too.
Yeah.
Well, that was another thing. Like my skin was so dry.
So dry.
And I didn't realize back then, you talked about frozen shoulder a while ago. I had frozen shoulder.
What is that?
For an entire year. I had no idea I was going to an orthopedic doctor getting steroid shots in my shoulder. And he told me, he said, you have frozen shoulder. I did not know.
That it was related to menopause.
Yes.
See,
People just don't know.
But see, this is why I also think, and this is me, just like the unpopular opinion, I'm like, this is that mindset, like, oh, it's frozen shoulder. It's not menopause. Menopause isn't a real thing. We're just going to brush that under the rug like it doesn't exist. And you're fine. We'll do some steroid injections in your shoulder.
Right.
Even the joint pain.
Yeah.
Like I had the joint pain. My mom has really bad arthritis, and I thought, okay, this is what it's going to be like.
This is it.
I'm going to, have arthritis and not be able to move.
So having that discouraged feeling finally, you're going to Rejuvime. The provider at the time tells you, Pam, you have nothing. Like, we are going to let's get you something. Yes. At that point, what was the initial treatment do you remember what the initial treatment that they put you on?
So I decided to start with the creams. So I did an estrogen cream. I remember I used to put it right here, and the testosterone cream, and then I took progesterone by mouth.
Okay.
I did that for a solid year. And they did tell me it takes a little bit longer, I think, for the creams to work. But I mean, it was probably 3 months before I started feeling better. That I feel like that was so long ago, but it started I just started feeling alive again. I'm like, oh my goodness, this is great. And we do travel a lot. So after a year of being on the creams, they talked about switching over to the pellets. And I was a little nervous. Yeah. Because, I read all the stuff. You Google everything. And there's a lot of people that talk negative about the pellets, which drives me crazy because I think certain things work best for our people. Pellets work great for me. We travel all the time. I'm not having to put the creams on, packing them in my suitcase. They work great for me. I have never had, and we've adjusted the dosage, tweaked it a little bit. Let's see if I feel a little better going down to a lower pellet or a higher pellet. And we've been doing great lately with my dosage, but they're so easy.
I love that.
So with the pellets, you will do estrogen, progesterone, and testosterone at the same time?
Bree, talk to us about what is the main methods of delivery, the differences between creams, injectables, orals, and pellets.
Yes.
Ooh, okay.
Yeah, what is a pellet?
And why did PAM evolve from a topical creams, right, into the pellets, and probably feeling better on pellets or
and I'm
better.
glad I did do the creams for me at first just because I had no hormones in my body to get some hormones before going straight to a pellet because not sure what dosage of the pellet feel.
So creams and pellets are both going to be transdermal, so they're going to be absorbed through the skin, right? And then there's oral, which is going to go in the mouth and then through the stomach, the liver, all the good things. And then some testosterone specifically can be done through an injection too.
Injection and pellet. You can do
pellet. You can do testosterone in a pellet. You can do progesterone in the pellet.
All three of these are available in pellet, but like you said, the data really supports the oral.
The oral
progesterone
for progesterone
best.
if you have a uterus. I do have women who want the effects of the progesterone, but they don't have a uterus due to a hysterectomy. And so they can do a triple pellet, meaning the estrogen, the progesterone, and the testosterone. And a lot of times that works very well for those women. So it really just is so personalized.
So tell us, a patient comes in brand new. Give us your treatment.
So brand new. If Dr. Weiler is my lady coming right in, and he's telling me I've never taken hormones before, but he's a female, right? So she's never taken hormones before. She's having all of the effects of menopause. No hormones on her labs. Full-blown menopause. I usually say, hey, let's try an estradiol cream vaginally to help with those vaginal symptoms. Let's try a topical estrogen cream like on the inner arm to get those estrogen levels up. And then let's do oral progesterone and injectable testosterone. That's usually my starter kit. And then we kind of adjust based on that and how you do on it.
So it seems like, with your lifestyle and stuff like that, after I think you said a year were on the creams and stuff like that. Is that just one of those things? Does it just become, you're like, okay, I'm set in my ways now. These are going to be my doses. Like, I don't want to pack the cream, like you were saying, pack the cream if you forget it and all that kind of stuff. Is that how y'all how did that conversation go to progress into pellets?
I think because at that time we had started traveling and he had mentioned it to me and said, do you want to try switching over to the pellets? Now we have some hormones in your body. And I said, let me just try it. And so we probably started with one of the lower ones. I had labs done 4 to 5 weeks after I had the pellet in to see where my hormones were. And we kind of decided how I was feeling and where my levels were, if I wanted to go up or down on the next pellet. And we just kind of went from there.
Just that slow tweaking.
Tweaking.
And we've changed my pellet over the last year on my testosterone, and I've had my labs drawn to see where And Bree's really good about saying, okay, let's come back and check. Now we've changed your pellet. Let's see where your levels are at 4 to 5 weeks.
How long does the pellet last? And what does a pellet, you got to dive a little bit deeper into pellets.
So the pellets, they look almost like a tiny, tiny Tic Tac. And
Grain of rice.
Yeah, like a grain of rice.
That's a grain of rice.
Grain of rice. That's a better description there. But they look tiny like that. We make a little numb spot on the top of your booty usually. Incision, tiny, tiny incision. Slide it in, glue in a Band-Aid. They last for about 2 to 3 months. Really depends on who you are and how fast you metabolize. Women who are on GLP-1 medications sometimes metabolize a little bit quicker. Runners, people who are heavy exercisers, they usually come back into that 9 to 10 week period to get another pellet versus those who are a little bit more sedentary or aren't having as much increased metabolism. Those patients can go 12, 13, sometimes even a little further, they can push it out.
Yeah, and like the great thing about pellets, like she was saying, it's an extremely tiny incision.
Tiny, you cannot feel it.
Yeah, like it's a quarter of an inch for an incision to be able to put those in. And so what they do is they'll move from like side to side. So like we'll put them on the left side one time, the right side, and just kind of like go back and forth. And it's in and out. No downtime, no nothing like that. Like she said, we don't even stitch it. It's just a little piece of glue, a little Band-Aid, and you're good to go out the door. You might have some soreness in the area, just like a little bit, but nothing that one Tylenol can't,
I've never
knock
had
out.
to take anything.
Yeah, that's what I'm like.
Right. I mean, sore, but not.
Nothing unbearable.
It's just like it's like you did like booty day at the gym,
Or you
it's
tell
just,
your husband, it's on the left side, do not slap
don't
me on the
exactly. Because why? Because the libido's back and everything's great.
Everything's great.
So yeah, I really do. I absolutely love the pellet
they're
option. I think
great.
that's so great once you've kind of figured out what your doses are and everything.
Absolutely.
But go ahead, Doc.
Bree, do you see a advantage for the patient beyond like the not having to do the creams and the lifestyle? Is there a medical advantage in your opinion on pellets, or do you feel like it's all equivocal, all kind of the same?
No, I do think
And everybody's different, obviously. But
I do think there are some benefits because it's transdermal. There is less risk for blood clots with transdermal methods of estrogen. But then beyond that, I do feel like my patients on pellets have more stable levels of hormones in their system, which makes them feel better.
Yeah.
You don't have as much high and low or any kind of dip. It's so gradual that you feel good 99% of the time.
release.
Yeah.
Yeah, that's slow release. That's good.
And then do you time it? You said 9 to 10 weeks to 3 months. Is that patient?
Specific.
It's patient
They
specific.
decide?
Not necessarily. So after your first pellet, we'll get those labs 4 to 6 weeks. Usually that 5-week mark is that sweet spot where you're at your peak. And at that time I can say, okay, Taylor, it looks like you're at a good spot here or maybe a little bit lower. And then usually I'll say, let's come back 5 to 6 weeks. So that'll be that 10 to 12 week mark, right? But if you start having hot flashes, night sweats, if you're not having a libido and you're feeling like your hormones have dropped, call me and we will see you sooner and adjust based on that too.
That's what I was going to say. Can you tell when your pellets are kind of like at that end of their life? Like that. It's like,
and I've tried to push them
Uh-huh.
back. I'm like,
Yeah.
oh, let me see if I can make it 4 months
Right.
this time. And like it's
no.
my energy level.
Yeah.
Yeah.
You can feel
You
that.
feel
at
it.
the
Crawling
moment.
feel
back
it.
into the
Yes.
office.
Yeah, and I've actually had a hot flash come back before too. Wow.
it's like,
And I was
ooh,
like, oh,
what
no,
is that?
no.
On the
It's time
phone,
to
and
go.
like
It's
in the middle of the
Let me get an
night.
appointment.
Speaking of side effects, you said you had a hot flash. Anything else that you experience?
I mean, the main thing was the frozen shoulder that I didn't realize at the time was
Yeah.
that. The anxiety.
No,
almost
from
depression.
the pellet.
Oh, from the
pellet.
side effects.
From the hormones. I mean, it all seems positive. But
mean,
is there
yeah.
anything?
No.
Yeah. I mean, it's
That's
just,
a
it
good answer.
sounds like it's
Well-
changed your life.
Yes,
Yeah.
it has
Truly.
changed my life. I asked my husband this morning, I said, all right, I'm going for this podcast. I said, I want to know from you, what's the one thing, because my husband loves me way more now than I'm on hormones.
That's like, yeah, I
He
mean,
said, I said, what do you see the difference? And he said, you're calmer. Not to mention the libido. It's
Right.
not just all about
Yeah.
that, but he
Right.
said you're just so much calmer. Like I was so on edge.
Well, you're more the person that he originally
Yes,
knew.
yes,
Right.
yes,
And
right.
I always,
Yeah.
I'm married. Also, my wife, we're older too. So, the contract wasn't changed. Does that make sense? So, you're still the
Right.
person that got
Yes.
married. You
Yeah.
still have that awesome time together, and it still allows you guys to be that couple.
Right.
Talk to me. You mentioned before we started rolling about the controversies of
yes.
hormones,
Oh, yes.
and talk to me about the social media stuff you see, and some of the positives and negatives, and what's your opinion, and how do you sort of
Combat that.
combat that, and people ask you
Yeah.
questions.
Yeah.
you know?
Well, and I was an esthetician, retired in December, and that was the one thing I
Congratulations.
love. Thank you. That was the one thing I love talking to my clients about the menopause stuff because people just don't talk about it. And I have helped so many women, not just as an esthetician, but now that they're on hormones, because they come back and they're like, "Oh my gosh, thank you so much for telling me this has been life changing." But some of them come back and say, "No, I went to my gynecologist and she told me absolutely no, that causes cancer." I will tell you, one gynecologist told me, she said, "You shouldn't be doing that. Only people do that that are going through the sex change." And I'm like, "Do I look like a man?"
Do it.
I mean,
You're about as feminine as they get, man.
It annoyed me.
Wow.
And I'm like,
Yeah, it is.
"Stop. Like, it's
why can't we have it? you
right,
know?
exactly." But the cancer causing thing, I hear that so much. So many of my clients would come in and say, "Oh, I can't get on them. My gynecologist said it causes cancer."
Okay, Bree, what's
So-
your 2 cents on that?
I have a lot of sense on that.
I got more than 2.
More than 2 for you. So, there was an old study way back, probably before I was born, and it was done with synthetic progesterone, synthetic estrogens. They did not do mammograms before they started this study on the women in the study. All the women were above age 65. It was just so poorly done. That study's been redacted, and the Women's Health Initiative came out a couple years ago, all positive things. I think the increased incidence of breast cancer in women on hormones, I think it was like a 1% chance of difference of increase, which if you think about it, lifelong, that's really not that big of an increase there. And you got to think about all the positives, benefits versus risks, right? If your personal risk for breast cancer is low, you don't have a family history, you don't have the BRCA gene, you've never had an abnormal pap smear, all of these other things, you're really a great candidate for it. And the positives, the benefits, the improvement in your heart health, your bone health, your brain health, your marriage, all of this stuff,
All of those things.
it's going to outweigh the risk 9 times out of 10.
Yeah, there's never been found a definitive increased risk
Right.
in any of these issues, such as breast cancer, uterine cancer, all these things, and it's a hot topic, right? And so people talk about it left and right. The only sort of contraindication to hormone replacement, and it's even not like 100%, is in a female if they've had breast cancer. Right, especially estrogen receptive, estrogen positive breast cancer.
Yeah.
Right.
And men cannot have hormone replacement if they've had prostate cancer.
Yeah.
In terms of testosterone, those are the only 2 very strong sort of whoa. Now, even in the face of that, people still do hormone replacement under the safety of their oncologist.
Right.
I
was about to say,
it's not
So
100%.
we see it.
Yeah, we see it.
We have
And they'll say,
oncologists
"Hey,
that'll
Because
sign
it's
off.
such-
I brought this from my oncologist,
Yes.
and
That
I
says-
want hormones." And I'll
Right.
say, "Okay, thank you."
Right.
Yeah.
Because
We'll-
life,
we'll
I
go.
say this all the time, life is about stratifying or quantifying your risks, right? Or saying, hey, I drive, I use this all the time, I drive a car because I don't want to walk there. It is more dangerous to drive a car than it is to walk. But the risks of driving a car are so low, right? You hear about accidents that, people do it all the time. It's like taking an airplane. So hormones are very much similar. The risks, I don't think there's any increased risks, okay? Maybe there's a study out there that says there's a slight, 0.01%,
Very
but
slight,
it's
yeah.
almost indeterminable. But the benefits of beyond 50 living your life and having a great quality of life far outweigh if there is any risks. And I'm not, I'm saying that very strongly. So those studies, especially the one Bree was talking about, was a ridiculous study.
Yeah,
Ridiculous.
That's a lot of traditional sort of medical older doctors hold on to, and that's where you get that. It causes cancer or sex change. And
Yeah.
Yeah.
they're just like there's bad waitresses, there's bad doctors out there.
Yeah.
Had a bad doctor there.
So, Ms. Pam, so obviously, like you said, you've been doing hormone replacement therapy for quite some time now. So just what, from prior to getting on therapy to where you are now, what has changed, like your daily life? Just like your go do things, have the energy. Like, what are your feelings now with this therapy?
I have so much more energy now. And so, I've always, like I said, I always worked out, but like my daily life, I go do Pilates, I work out, I eat healthy. And also I feel like, I wanted to talk about this a while ago, the skin health with women that get on hormone replacement therapy. People ask me all the time, about my skin. I do take care of my skin, but I think getting on, if you look at my picture back from when I was 44 to what my skin looked like now, it's not just all the treatments that I do on top of my skin, it's the hormone replacement
that
therapy.
internal.
Getting the estrogen in there because your skin gets so dry and crepey looking, and I feel like having the estrogen has helped with that too. It's not just, all the creams I put all over my face.
Well, just as much, I know we talk about this too, just as much as we take care of the outside, you got to take care of the inside, and so, I think that's that's amazing. But, so you said you talk to your clients all the time and everything, when you're doing facials and stuff, what is that best advice that you're giving these women who are talking to you? And cause like we said, it's the group text, everybody's got one, somebody's talking about it. You're talking about whoever's doing your hair. What are you telling them when they talk to you about their symptoms and stuff?
To go get up, and I'm very open about it. One-on-one with people, I'm not afraid to talk about it at all. Even the libido thing, I'm not afraid. But when they start talking to me, because it's sad. I feel like sometimes marriages are falling apart because of that.
1,000%.
And it's really sad. And I just tell them, go get your labs done. And that, my gynecologist doesn't do a full hormone. Then go, and I always send me y'all's number. Go to Rejuvime, just get it done.
You don't have to do anything.
If everything comes back
You have nothing to
normal,
lose.
then it's not that.
Because we just met. And
we love you.
We love you. But you came in here, you talked about, how excited, you're an empty nester, which is awesome.
Yes.
It's that, so we're on the verge, me and my wife, of it. We're still a few years away, but can't wait to when we can travel, like you're traveling, experience life, visit your kids and your grandkids in different locations. And so I think 25 years ago, 30 years ago, it was, hey, you hit 50 as a woman or 55 as a man, and put them away in a back room and it's grandma and her life's over, right? And these days, it can be the best part. You have a great partner.
Living again.
You have a great partner to share it with, right?
Yeah.
And there's no reason you shouldn't have a hell of a time until you can't walk anymore, right?
Yeah.
And I think it's the movement towards, whether you call it replacement as you get older or optimization when you're younger. It's just another tool that we're using to enjoy our lives, right? And you've put all, like you said, you just retired. You've got all the, the travel, the time. You look amazing. I mean, you could be mistaken for a 25-year-old. Trust me, you look fabulous. But it's such a change in mindset.
Yeah.
It really is to our parents' generation, right? And we're taking control of our later years and living them just as fun and energetically and to the max that we did when we were 25.
Yeah. I do have one question. So you were talking about going to see your GYN and then coming to Rejuvime and whatnot. At Rejuvime, we do have mostly female nurse practitioners. Was that something?
I mean, you can be honest. We started with male.
Started with
be
a
honest,
male.
Started with
That's
a
right.
male.
Yeah, started with a
It
male.
was a male.
So you went from talking to a male nurse practitioner about these symptoms. Who did it? They got you on the right path.
Right.
How did you feel when you ended up of course, when we got Bree and she was able to continue to help this journey with you or go on this journey? I always talk about my my road trip buddy. So now you've got Bree with you. How was that in shift?
It's easier to talk to a woman, about certain things. And she's so easy to talk to. I have never once felt uncomfortable to talk about anything with her. The funny thing is my husband goes now too. And he's like, I don't know if I can tell her. I'm like, she's fine.
Don't worry about it. It's no big deal.
It's funny you say that. I do feel like guys sometimes are a little bit hesitant. I'm like, I know what you want to say.
I
know.
I know. It's
I
like
know
just
what you
say
wanna
it.
say.
So yeah, that comfortable, and that's, once again, we always hit on, like, make sure you find a provider, make sure these providers know what they're doing. We had talked earlier about, providers who do this all day, every day. This is what they do. Bree does, all of our nurse practitioners do all this continuing ed on hormone specific things, just hormones. That's all we're looking into.
Yeah, and those of you that are listening that aren't living in Louisiana, Mississippi, and up in Seattle, there are great.
Absolutely.
Find yourself a great hormone specialist.
Yes.
Wherever you're at. And that's really the take-home message there.
Yeah.
Right?
Absolutely. Yeah. So, Miss Pam, is there anything at all that you want to tell any women that are listening to us today on the podcast when it comes to the menopause, which I'm absolutely thrilled that we are actually talking, like everybody's
Bringing
talking
light
about
to
it.
it.
Yes.
Yeah.
Is there any, the message that you want to give them regarding this?
Hang in there. Get your labs done and get your life back. Like, to feel young again. At the age, I'll be 57 in May. I feel better at this age than I did probably in my 30s.
Wow.
I love it.
It's incredible. Yeah.
It's amazing.
And if you were to ask my husband, he said, it's like I have you back when you were 20.
I love that.
I don't want to look 20.
No.
I'm not trying to look 20, but I want to feel good. And it has made all the difference. Just get your labs done.
I love that. I love that.
Take that leap, right? Do
Take
it.
that leap.
I
Do
want
it.
every woman to feel great. And
You
it
don't
always
have to
breaks
feel this
my
way.
heart because I
Yes.
want them to feel the way I feel.
Yeah.
And not
I love
saying
that.
everybody's going to feel like that, but it is all the women that I've sent so far, they come back and it's thank you so much for talking to me about that.
Before we leave, what do you think the biggest impediment is for ladies that are menopausal or postmenopausal, right, to looking into this? Is it fear? Is it what do you think prevents?
Because so many people
misinformation?
have said it causes cancer. That's the
Yeah.
biggest thing I hear from most women.
I would say
And,
Yeah.
and it bothers
Fear.
me
I agree.
so much because I do think more people are speaking out about it.
Yes.
And I'll share some things on my Instagram. I never talk that much about because I'm not a doctor, I'm not a nurse practitioner, and I feel like I don't have I can talk about my own experience, but I feel like I'm not going to listen to her. She's not so I usually will try and share other doctors that I like, that's talking about it, to hear about it, just to kind of get it out there. And then they'll message me back and say, well, wait a minute, where do you go for that? Because, as doctors I share that's all over. It's not.
Right.
And I'm like, here, this is where you go. Just go get your labs done.
Yeah.
And then you go back a week later and meet with a nurse practitioner, and they will go over your labs and get your life back.
I love that. I know, absolutely. There is nothing. I love when we have patients come in that we've heard it multiple times. This saved my marriage. And it's just having them say that, it's so lovely.
So rewarding.
It's so rewarding because they want, and it's like, we can help you get there.
Yeah.
So, well, yes. Thank you so much for joining us, Pam. Thank you
thank
so
you, Ms.
much
Pam.
Thanks
for
for
sharing
having
your
me.
story, your journey, your before, your after, and everything in between. Thank you for letting us know, Bree. Thank you always for joining us with your expert insight and everything. Everyone, please make sure to give us a like and a follow. Make sure
Subscribe below.
Subscribe below. We are now on Instagram, TikTok. We're on all the streaming platforms and everything. It's at The Consult Podcast. Remember, always stay curious, always stay informed, and always consult before you cut. And we will see y'all next time. Bye.
Thanks, guys.